Hi, Dr. Pelto here. I want to do a little video today about how to cut your toenails. There's a lot of people in the last few days that haven't been able to go see their podiatrist, and a lot of people have concerns about if they can get in due to their age, due to everything that's happening today. So I want to give you some tips on how to cut your toenails if you have to do it on your own. If you can't see, this is one of the things that can't be done by telehealth. But I want to start out by saying that less is more. So trimming or filing is always a good option to do less, but I want to go over some of the more difficult cases. So let's look here. First, I want to talk about what equipment you're going to need, how to cut your nails, the types of nail problems, some precautions, and when to contact your doctor. Here's an example of a nail that is trimmed right at the tip here. What you're going to need, either a traditional standard nail nipper or a podiatry grade nipper, and then maybe even a nail file. And I'll give you a couple of links at the end where you can purchase these on Amazon. Pretty easy to get them at your house. So let's start with how to cut your nails properly. Once again, less is more, so try not to cut too much here. You can see this is cut too short. This is a nice rounded one, but be careful about going into the edges. Going into the edges can typically cause ingrown toenails, such as this V. There's a V here that people do, and there's also another type of a V that some people do a wedge in the V to help prevent ingrown toenails. Here's a way one that's properly cut. You can kind of see here on the side. Okay, so just be careful when you're trimming them. Try to do less, or even filing them is a good option. But if they're really, really big, and that's what we're going to go over, some of the more complicated ones. What are some of the common nail problems? So here up on the left, you can see this is an example of an ingrown toenail. This needs to be seen by a doctor. You can't treat this on your own. You need to see someone. If it's only the beginning of this, not so bad. You can try to tape down the edge with a Band-Aid, kind of pulling down to the edge of the nail and soaking it. On the upper right-hand corner, you can see an ingrown toenail here. Once again, you can try to trim this if it's not uncomfortable, but if it is uncomfortable, you should see a doctor. On the bottom left, this is a fungal toenail. This is going to be hard to trim. I would recommend soaking prior to doing it. And then here on the bottom right, you can see this looks like a normal nail, but you can see in the nail edge right here, right by the tip of the nail in the edge, there's a callus, and that callus can be very problematic for people, kind of causing an ingrown toenail. So this one you can probably trim on your own by either trimming a little of the callus off, trimming the nail, but be real careful when you're doing that. You could even use a cream to kind of soften the nail edge as well. Those are the most common nail problems that we see in the office. And so the tips are soaking for the real thick one, doing as minimal trimming as you can. And if there's an infection, you need to see your doctor. That's considered an emergency. So some of the precautions I'd like you to be aware of. The biggest precaution, frankly, is a vision problem. A lot of my patients have vision problems and they can't see their nails, or they have flexibility problems. I know this looks easy in this picture, but it's really hard to get down and do your own nails, especially with this nail nipper or even with the other one. So you have to be very careful. Very, very commonly, I see people cutting their skin. So try to have a loved one help you to do it, and try to do less and soak before to make it a little bit easier. Once again, if you have any problems, let your doctor know. Poor blood flow is also an issue because that can be a problem with either varicose veins or swelling. That can cause skin color changes. What's the whole problem with the circulatory problems? Well, if you develop an infection or a cut, it could be problematic. There could be circulatory problems. So if you have circulatory problems, be very, very careful trimming your toenails. Also, if you have diabetes or neuropathy is where the nerves, you can see a normal nerve here up on the upper left-hand corner here, and then a diseased nerve where the blood flow that goes around the nerve gets reduced, and then the nerve doesn't share the sensatory feelings as much. The problem with this, with the nerves, is that you can't feel. So you may get a cut, you may get an ingrown toenail, you may get a problem and not even know it. Okay. When should you contact your podiatrist? Basically, if you have an ingrown toenail, that's the biggest reason. If there's red, hot, swollen, infected, you can't deal with that on your own. You have to see someone. There are some patient resources. So if you take your smartphone and you're watching this, you can just scan this picture here. You can also, I'm going to put a link so you can download this afterwards, and you can click on the links. There's one link that goes to Amazon and another one that goes to YouTube with a list of videos. On this, I'm going to show you a list of items that we just talked about that you can purchase on Amazon, some good recommendations. And YouTube has other videos on ingrown toenails. If you want to download this whole presentation with the links, I'm going to leave this up here a little bit at the end. You can take a picture with your smartphone or use your QR reader, and that'll give you the actual presentation that you can review and have the links there to click on. Hope you enjoyed this. Thank you.